If you're a male, I'm going to talk to you today about 3 different approaches to restoring a more youthful appearance to your eyelids. You may be looking in the mirror and saying to yourself, geez, I look tired. I've had a good night's sleep, and yet my eyelids look baggy and droopy, and I'm wondering what the heck can I do about this? So you may be a great candidate for eyelid or eyebrow surgery, and I'm going to break it down and make it really simple for you. So let's talk about Tom Cruise in detail. I think he's a great example of a male who has natural aging of the periorbital area around his eyes. And we can see from an early age that he already had a low brow. And this low brow position has remained throughout his entire life and has progressed. And as it progresses, the brow starts to descend in the lateral position as well as the eyelids, and they start to crowd his upper eyelid itself. So there's a descent of the brow, and the descending brow also creates a fold of skin here. It's not just the laxity of the eyelid skin, but it's actually the crowding that occurs as the brow descends. And he has chosen not to do anything and alter his brow because that's a distinctive feature he wants to maintain as a Hollywood figure. However, most men who come in who have this crowding and this brow descent, they want to do something about it. So how do we approach that? First, raising the brow. I don't want to create a brow that's high or an arch, which has a more feminizing appearance to a male. Therefore, the brow always has to maintain this horizontal characteristic, and I call it the T with the bridge of the nose. And a low brow is certainly a male distinctive feature. However, we do want to sometimes raise the brow and modestly, very modestly, and we do that either with a direct brow lift, which is over here, an incision at the hidden at the top of the brow hairs, or I do it endoscopically behind the hairline, or even if they have a receding hairline, it's well hidden. The incisions back here, they heal well in men. In regard to the upper eyelid, that is an area that I particularly pay tremendous attention to because it is very easy to effeminize the appearance of a male by creating too high a lid crease. A high lid crease is associated with women in our society, and therefore it is important to maintain a very low crease for a male. That's another characteristic that distinguishes men from women. You may require just a brow lift to restore a younger appearance to your eyelid area, but other people require both eyebrow and eyelid surgery, and sometimes a little trimming of bulging fat in the inner corners is also required. In regard to the lower eyelid, that's an entirely different subject, and that has to do with bulges of fat that occur due to the downward descent of fat from behind the eye due to gravity and age. So as we age, there is a laxity of these tissues that prevent the fat from spilling forward, and there's a laxity of fibers behind our eyeballs which actually allow the fat to be suspended behind the eye, and they become lax, and the fat kind of spills forward, downward, and forward in a very passive way. That fat is usually approached through an inner eyelid approach, which means a transconjunctival approach, and there's no external incisions that are seen. If there is any laxity of the skin, typically that skin can be either lasered or a chemical peel could be applied to the skin, which can tighten the outside of the lower lid. And occasionally I have to tighten the corners of the eyes also to resuspend the eyelid so it doesn't sag following surgery. So just to recap, we've talked about brow lifting, upper eyelid surgery, and lower eyelid surgery. And people then ask, well, what is the right age for me to have a blepharoplasty? And the answer is it really depends upon what kind of changes that are present. I mean, there are people who are in their late 20s to 30s who need brow lifting and blepharoplasties. Of course, most of the patients are probably in their 40s to 60 age range, but there are younger people also who have operated on, both men and women, by the way, who are young, and they just have these changes around their eyelid that they want to enhance. So when you go for eyelid surgery, the upper eyelid surgery is simple. It typically can be done under local anesthesia alone. When you're thinking about doing a brow in addition to the upper eyelid, then I would recommend an IV sedation to make it more comfortable. The lower eyelid can either be done under local anesthesia or with anesthesia, IV sedation. And the recovery is very quick in all these procedures. Usually within 5 days, I take out the sutures and you're back to work approximately in 1 week, and there's very little discomfort associated with it, and you're basically back into your normal activities. I don't like people to go back to their full exercise routine for at least 2 weeks to make sure that they're healing well. I'm an expert in my field. I've been doing this for over 30 years, and if you have any further questions regarding eyelid or eyebrow surgery, please leave them below. I'm more than happy to answer your questions, and I look forward to seeing you in my next video.